Have you ever just felt off, more tired than usual? Perhaps. Or noticed something a bit different that you quickly brushed aside as just part of getting older? It's a common story, isn't it? As we mature, we tend to attribute every new ache, every fleeting symptom, to the natural process of aging. We tell ourselves, "Oh, it's just my back," or "I'm not as young as I used to be, so a little puffiness is normal." And for many things, that might be true, but here's a painful reality: our hearts, those incredible engines that keep us going, often send us subtle, almost whisper-like signals when they're struggling, especially after 60. And the heartbreaking truth is, we often miss these crucial messages because they don't look like the classic chest-clutching scene from a movie. Our hearts don't always scream for help. Sometimes, they just quietly let us know something's amiss in ways that can seem completely unrelated. It's like our body has its own secret language, and we're not always fluent in it. But what if you could learn to understand those whispers? What if you knew the strange, often overlooked symptoms that could be telling you your heart needs a little attention? In this video, we're going to uncover 6 of these surprising signs that reveal your heart might be in trouble after 60. These aren't the ones you usually hear about, and recognizing them could make all the difference. So, settle in, because if you watch to the end, you'll discover something truly surprising about how your body communicates with you. Let's dive right in and talk about the very first symptom, one that's so easily dismissed because it's a feeling we all experience: persistent, overwhelming fatigue. Now, I'm not talking about feeling a bit tired after a busy day of gardening or chasing after the grandkids. That's normal, healthy tiredness. What we're talking about here is a profound, unshakable weariness that doesn't go away, even after a good night's sleep. It's the kind of fatigue that makes simple tasks, like walking across the room or doing the dishes, feel like running a marathon. You might find yourself canceling plans, opting for a nap over a social outing, or just feeling utterly drained by mid-morning. Why would this be a sign of heart trouble? Well, think about what your heart does. It's constantly working to pump oxygen-rich blood to every part of your body. If your heart isn't working as efficiently as it should, if it's struggling to keep up, then your muscles and organs aren't getting the consistent supply of oxygen and nutrients they need. It's like trying to drive a car with a half-empty fuel tank. You just don't have the power to go very far or very fast. Your body's response to this lack of proper circulation is to conserve energy, leading to that bone-deep exhaustion. You might notice it particularly in your legs, feeling heavy and weary just from a short walk. Or you might find yourself out of breath doing things you used to do with ease. This isn't just about feeling sleepy. It's about a lack of vitality, a constant feeling of being completely wiped out, even when you haven't done anything strenuous. If you've noticed a significant, unexplained drop in your energy levels, if you're constantly feeling fatigued in a way that's new or different for you, it's a whisper from your heart that you shouldn't ignore. It's your body telling you that its primary engine might not be running at full capacity, and it's worth a conversation with your doctor. Moving on from that profound tiredness, let's consider a symptom that's also incredibly common as we age, but can, surprisingly, point to heart issues: swelling in your ankles, feet, or legs, also known as edema. Now, many of us will experience some swelling after a long flight, a hot day, or standing for too long. That's usually normal, but if you start noticing persistent swelling, especially in both legs, that doesn't go away overnight. Or if your socks leave deep indentations on your skin that linger for a long time, that's a different story. It's the kind of swelling where your shoes suddenly feel tight, even first thing in the morning, or your ankles look puffy and feel heavy. This happens when your heart, particularly the right side, isn't strong enough to effectively pump blood back up from your lower extremities. Gravity naturally pulls fluid downwards, and if your heart isn't efficiently returning that blood to the rest of your body, fluid can start to build up in the tissues of your legs, ankles, and feet. Imagine a plumbing system where the pump isn't quite powerful enough to get all the water flowing back up the pipes. Eventually, the water starts to pool at the lowest points. That's essentially what's happening with your circulation. You might notice that if you press your finger firmly into the swollen area, it leaves a dimple that stays for a few seconds. What doctors call pitting edema. This isn't just an aesthetic concern. It's a physical manifestation of a circulatory issue. It can make walking uncomfortable, affect your balance, and even make your skin feel tight or itchy. If you're seeing new, unexplained, or persistent swelling in your lower limbs, particularly if it's getting worse, it's a strong indicator that your heart might be struggling to manage its workload and is having trouble keeping the fluid balance in your body in check. Just like with fatigue, this symptom alone can be caused by many things. But when it's new and persistent, especially after 60, it absolutely warrants a discussion with your healthcare provider. These are early signals, often easy to dismiss, but so important to pay attention to. Now, as we consider these subtle shifts, there are even more surprising signals our body might be sending, ones we often dismiss as harmless, but which could be telling a much bigger story about our heart's health. Next up on our list of surprising symptoms, one that many people mistake for a common cold, allergies, or even asthma, is a persistent cough or wheezing. Now, we all get coughs from time to time, especially during flu season, and many of us deal with seasonal allergies. But if you've developed a chronic cough that doesn't seem to go away, especially if it's worse when you lie down at night, or if you find yourself wheezing or producing pink, frothy mucus, your heart could be trying to tell you something important. This kind of cough isn't just an irritation in your throat or lungs. It can be a sign of fluid buildup in your lungs, a condition known as pulmonary edema, when your heart, particularly the left side, isn't pumping blood effectively. Blood can back up into the veins that go to your lungs. This increased pressure forces fluid from the blood vessels into the air sacs of your lungs, making it harder to breathe and triggering a cough reflex. Imagine a river that's backed up because of a blockage downstream. The water starts to overflow its banks. That's what's happening in your lungs when your heart isn't able to move blood forward efficiently. This cough can be dry or produce white or pink-tinged sputum, and it's often accompanied by shortness of breath, particularly when you're exerting yourself or lying flat. You might find yourself needing more pillows to sleep comfortably at night because lying flat makes the cough and breathlessness worse. It's a very distinct sensation, different from a typical chest cold or allergy attack, because it stems from within your circulatory system, not primarily your respiratory system. If you've been battling a cough or wheezing that just won't clear up, and especially if it's paired with new or worsening breathlessness, don't just reach for cough drops. This could be a vital signal from your heart, indicating that it's struggling to keep up and manage the fluid balance within your body, leading to congestion in your lungs. It's certainly a symptom that warrants immediate medical evaluation to determine the underlying cause. Moving on from coughs and congestion, let's talk about pain, but not necessarily the kind of chest pain you might expect. When we think of heart trouble, our minds often jump straight to that classic, crushing chest pain. But for many people, especially women and those over 60, heart-related pain can show up in much stranger, more subtle places, often far from the chest itself. We're talking about unexplained pain or discomfort in your jaw, neck, back, or even your arm, particularly the left one. This phenomenon is called referred pain, where pain signals from your heart get confused by your brain and are felt in other parts of your body, often those that share nerve pathways with the heart. For instance, you might experience a dull ache in your jaw, as if you've been clenching your teeth all night, or a strange, persistent stiffness in your neck. Some people describe it as discomfort between their shoulder blades, a feeling that's often dismissed as just a muscle strain or general back pain. And while arm pain is a well-known symptom of a heart attack, it's not always the sudden, intense variety. It could be a tingling, numbness, or a dull ache that spreads down one or both arms, sometimes even into the hand. What makes these symptoms particularly tricky is that they can come and go, or they might only appear during physical exertion, like walking up a flight of stairs or carrying groceries, and then ease when you rest. This is a crucial clue, because if the pain or discomfort consistently arises with activity and lessens with rest, it's a strong indicator that it might be related to your heart's blood supply struggling to keep up with demand. Many people, particularly women, tragically dismiss these symptoms as non-cardiac, leading to delays in seeking help. They might think it's just indigestion, a pulled muscle from lifting something, or even arthritis. But if you experience new, unusual, or unexplained pain or discomfort in your jaw, neck, back, or arm, especially if it's brought on by exertion or accompanied by other symptoms like shortness of breath or dizziness, it's not something to brush off. Your heart could be sending out a distress signal, asking for attention in ways that are far less dramatic than we're often led to believe. Recognizing these less obvious pain patterns is incredibly important for timely diagnosis and intervention. And speaking of less obvious signals, the next strange symptom might genuinely surprise you because it affects an entirely different system: digestive issues. Yes, that's right. Problems like nausea, loss of appetite, or persistent stomach pain can actually be quiet alarms from your heart. When you think about it, it makes sense. Your digestive system needs a healthy, consistent supply of blood to function properly. If your heart is struggling to pump blood efficiently, it might prioritize sending blood to vital organs like the brain, potentially reducing the supply to your digestive tract. This reduced blood flow can lead to feelings of nausea, a general lack of hunger, or a persistent, dull ache in your upper abdomen. Furthermore, if your heart isn't pumping effectively, fluid can back up not just in your lungs and legs, but also around your liver and intestines, causing swelling and discomfort in your abdominal area. This can make you feel bloated, full very quickly even after eating very little, or just generally unwell in your stomach. You might experience persistent indigestion-like symptoms, even if you haven't eaten anything particularly heavy or spicy. It's often mistaken for a stomach bug, heartburn, or just a sensitive stomach. But if you find yourself feeling frequently nauseous, losing your appetite for no apparent reason, or experiencing stomach pain that isn't clearly tied to specific foods or typical digestive upsets, and especially if these symptoms are new or persistent, it's worth considering your heart. These digestive disturbances, particularly when they're accompanied by other symptoms like fatigue or shortness of breath, are your body's subtle way of saying that the entire system might be under strain due to a struggling heart. It's an easy one to miss because it seems so disconnected. But it's another piece of the puzzle your body is putting together to warn you. It's truly remarkable how many different ways our body tries to communicate, isn't it? And speaking of surprising connections, the next symptom might make you scratch your head, as it's so often dismissed as something entirely benign. So, let's explore our sixth and final strange symptom episodes of lightheadedness or dizziness. Now, everyone gets a little dizzy from time to time, especially if you stand up too quickly or haven't had enough to drink. That's usually nothing to worry about. But if you're experiencing frequent or persistent bouts of lightheadedness, a sensation of spinning, or feeling like you might faint, and these episodes aren't easily explained by something obvious, it could be your heart sending a vital message. The brain, much like every other organ, needs a constant, steady supply of oxygen-rich blood to function properly. If your heart is struggling to pump blood efficiently, or if it's beating too fast, too slow, or irregularly, it can momentarily reduce the blood flow to your brain. This temporary reduction in supply can manifest as dizziness or lightheadedness. Imagine a garden hose with a kink in it. The water flow becomes intermittent or weak. Similarly, if your heart's rhythm is off, or its pumping power is reduced, the consistent flow to your brain can be disrupted, leading to those disorienting sensations, You might feel a sudden rush of faintness, a swimmy feeling in your head, or an unsettling loss of balance. It can be particularly concerning if these dizzy spells happen without warning, or if they occur during exertion, or even worse, if they're accompanied by other symptoms we've discussed, like chest discomfort or shortness of breath. Many people dismiss these as just a sign of aging, or perhaps low blood pressure. And while those can certainly be causes, it's critical to rule out a cardiac origin. An irregular heartbeat, for example, known as an arrhythmia, can cause these sensations. And while some arrhythmias are benign, others can be serious and require medical attention. So, if you find yourself feeling lightheaded or dizzy more often than usual, or if these episodes are new and significantly impacting your daily life, please don't just shrug them off. Your heart could be letting you know it's having trouble keeping up with the demands of supplying your brain with the vital blood it needs. So, we've talked about how persistent fatigue that goes beyond normal tiredness, unexplained swelling in your ankles or legs, that nagging, chronic cough that just won't clear up, unusual aches in your jaw, neck, back, or arms, those unexpected digestive troubles like nausea or a lack of appetite, and even episodes of lightheadedness or dizziness can all be whispers from your heart, signals that something might be amiss. These aren't the dramatic, movie-style heart attack symptoms. Are they? That's the truly surprising part. These subtle, often overlooked signs are the ones our body uses to communicate with us long before things become critical. The surprise is how interconnected our bodies are, and how these seemingly unrelated symptoms can all point back to the incredible, hardworking organ that keeps us going. The real revelation here is recognizing that just getting older isn't always the full explanation for new or worsening symptoms. Please, listen to your body. It has an incredible capacity to communicate with you, and understanding its language is one of the greatest gifts you can give yourself as you age. It's not about panicking every time you feel a bit tired, but about cultivating an awareness, a gentle curiosity about what your body is trying to tell you. If you notice any of these strange symptoms, or a combination of them, particularly if they are new, persistent, or worsening, the most important step you can take is to talk to your doctor, share your concerns, explain what you've been experiencing, and let them help you determine what's going on. Early detection and intervention can make all the difference in managing any potential heart issues and helping you maintain your quality of life. Remember, small changes in your awareness and a proactive approach to your health can make a profoundly big difference to your well-being and happiness for years to come. Your heart has worked tirelessly for you for decades, and it deserves your attention and care now more than ever. We hope this video has given you some valuable insights and empowered you to listen more closely to your body's subtle signals. If you found this information helpful, please let us know by giving this video a thumbs up. And if you have any of your own experiences or thoughts on these symptoms, we'd love to hear from you in the comments section below. Your shared wisdom helps others in our community too. Don't forget to subscribe to our channel for more helpful content designed to help you live your best life at every age. Thank you for watching. And remember, your well-being is precious. Keep listening to your body. Keep taking care of yourself. And live your best life at every age.